next we'll see what are the type of forces, the internal and external forces. The internal and external forces. What do you mean by the internal and external force? What are the internal forces? The internal forces are the forces that is produced inside the body. What are the internal forces? The force of muscular contraction, the force produced by the ligament on the bone, the force produced by the ligament on the bone, the joint reaction forces, the joint. All these are called as the internal forces. So the force of muscular contraction, the force produced by the ligaments on the bones, and what else? The joint reaction forces. What are the external forces? What are the external forces that acts in your body? The gravitational force. The gravitational force. That is the universal force that acts on each and every one's body. That is the external force, the gravitational force. Second force is the force of friction. What is a friction? What is a friction? What is a friction force? Friction forces are forces when occurs when two surfaces slides, when one surface slides on the other. Or in other words, two surfaces make contact with each other. Is called the frictional forces. Okay, so the frictional force is an external force. Frictional force, again, then the ground reaction forces. So that's what I'm telling. When you're applying a force towards the ground, when you're walking on the floor, your body is providing a force to the floor, and in return, the ground will produce a force towards the body. Okay. So due to any pathological condition, due to any old ages and all, when the ground reaction forces exceeds the forces that is your body is applying, and if the body cannot tolerate that excess force produced by the ground, you can get some pain in the particular joint. The heel pains, what you are getting is one of those reasons. There can be some underlying pathology behind it, but the ground reaction forces cannot be tolerated equally by the joints. In a normal joint can tolerate, but in a pathological conditions, the body cannot tolerate those unbalanced forces, which result in pain. And the other is the resistance. The external resistance. What do you mean by the external resistance? Again, the external resistance can be of different types. When you are giving any resistance training, example, when you are using the hydrotherapy, the resistance offered by the hydrotherapy, okay, especially the buoyancy of the water, which can be used as an assistance of the resistance. So those resistance produced by the water in case of hydrotherapy, or the resistance produced by the weight cups, dumbbells, or the resistance strings in exercise therapy can be examples for external forces. Okay, so these are the two types of the forces that is acting in the body, that is the internal forces and the external forces. Now let us see what are the force system. What are the force system acting in the body? Force system. So force system can be divided as the linear force system, parallel force system, and concurrent force system. Okay, force system can be divided into as a linear force system, a parallel force system, and a concurrent force system. Okay, first let us see what is a linear force system. So a linear force system exists when the forces acting at the same point of application. When the forces acts along this at a same point of axis. When the same point of axis or the same common action line. When the forces acts along the same action line, it is called the Linear forces. When the forces act along the same action line, it can be of same direction or it can be opposite direction. It can produce compression at the joint as well as at a distraction of the joint. Okay, it can be a compressive force or it can be a distraction force or a traction force. So both traction as well as an approximation can happen due to these forces. So a linear force system exists when two or more forces acting at the has got a same action line. So the forces can be of in the same direction or in an opposite direction. It can produce compression or it can produce a tractional force. Give an example. So imagine you are giving traction to a patient. Take an example, you are giving a cervical traction to the patient. Okay, the cervical traction. So what happened is that the machine is providing a pull in one direction. Okay, and your body is providing a force in the opposite direction. But both these forces are acting in a has got a same action line even though they are in opposite direction, which eventually produces a distraction force at the joint. So linear force system, traction unit is an example for a linear force system. And give another example in the human body, any muscular action where you have the linear force system. Take the example of the action of hip flexon muscle, hip flexion, action of hip flexion by iliacus and psoas muscle. Okay, the iliacus and psoas muscle, they produce hip flexion even though both arise has got different origin, both inserted at the common point at the greater trochanter of the femur, and there has both the iliacus and psoas has got the same action line which can produce flexion at the hip joint. The action of iliacus and psoas in flexion of the hip joint is an example of a linear force system. And next one, we'll go to the parallel force system. Okay. And here in a parallel force system, the forces acts parallel to each other. It doesn't have a common action line. The forces acts parallel to each other. The forces acts parallel to each other. Okay, these forces acts parallel to each other. What is and when you think about the parallel force system, there is another important topic in parallel force system called the levers. What is a lever? Lever. Lever. What is a lever? A lever is a rigid bar which is capable of rotating on a fixed axis called fulcrum. A lever is a rigid bar which is capable of moving on a fixed axis called fulcrum. This is a lever. So which fixed axis called fulcrum. Work is done on a lever when weight is acting on one side and effort is acting on the other side. Work is done on a lever when weight is acting on one side and fulcrum is acting in the middle and effort is acting on the one side. And the distance between the weight and the fulcrum is called the weight's arm. And the distance from the fulcrum to the effort is called the effort's arm. Effort arm. Okay. So in the human body, how will you represent levers? The bones can be considered as levers. In the human body, bones are considered as levers. Bones are considered as lever. Bones are considered as levers. And what is the weight? Weight is the object to be lifted. Okay. The weight is the object to be lifted, or weight is the body segment. So if I want to do elbow flexion, the fulcrum is at the elbow joint. The weight is my forearm and the hand segment is the weight. And what is the effort? Effort is the point of insertion of the muscle. So if I want to do elbow flexion, my biceps muscle, the point of insertion of the biceps muscle at the bicipital tuberosity of the radius acts as the effort. Okay, so basically we have three orders of lever. In a first order lever, the fulcrum comes in between the weight and as well as the effort. In a first order lever, fulcrum comes in between the weight and the effort. In a second order lever, weight comes in between the fulcrum and effort. And in a third order lever, effort comes in between the fulcrum and weight. Is there an example of third order lever? So let us see what is the first order lever. In the first order lever, the fulcrum comes in between the weight and the effort. And here you can see the weight sum and the effort sum are equal to each other. The weight sum and the effort sum are equal to each other in a first order lever. You had seen the seesaw. If a person A is sitting here, the person B is sitting here. So they are moving up and down. The central one is the fulcrum. So seesaw is an example of first order lever. The old weighing pan is an example of the first order lever. In the human body, the first order lever, you can see the nodding movement of the head, the movement at the atlanto-occipital joint. The atlanto-occipital joint acts as the fulcrum. The weight is the weight of the face, the weight of the head, which is passing anteriorly. Effort is the posterior neck muscle at the insertion into the occipital bone, acts as the effort. So nodding movement of the head. In the nodding movement of the head, atlanto-occipital joint acts as the fulcrum. Weight passes anteriorly on the face. Effort is the posterior neck muscles inserted at the occipital bone, acts as the effort. Okay. And in the second order lever, weights comes in between the fulcrum and the effort. Weight comes in between the fulcrum and effort. So what is the distance from the fulcrum to the effort is called the effort's arm, and the distance from the fulcrum to the weight is called the weight's arm. Here in a second order lever, you can see the effort's arm is greater than the weight's arm. Here the effort's arm is greater than the weight's arm. If the effort's arm is greater than the weight's arm, you got mechanical advantage in a second order lever. Mechanical advantage is equal to weight by effort. So that is, in order to lift in a second order lever, in order to lift a 10 kg of weight, we need only 5 kilogram of effort. So the mechanical advantage is 2. In a second order lever, the mechanical advantage is always greater than 1. Whereas in a first order lever, since the weight sum and effort sum are equal to each other, in order to, what is the mechanical advantage in a first order lever? Mechanical advantage in a first order lever. In order to weight, what is the weight? If the weight is 10 kilogram, effort required is also the 10 kilogram. The mechanical advantage is only 1. There is no mechanical advantage in a first order lever. But in a second order lever, there is a mechanical advantage in a second order lever. Okay. And what is mechanical advantage? Mechanical advantage is the ratio of the weight by effort. Okay, so what is mechanical advantage? That is, with less effort you can carry more weight. So in a second order lever, mechanical advantage is always greater than 1. Okay, and in a first order lever, the mechanical advantage is always equal to 1. So there is no mechanical advantage in a first order lever. So what is the anatomical example for second order lever? The anatomical example for a second order lever is the action of brachioradialis muscle in the flexion of elbow joint. The action of brachioradialis muscle in the flexion of elbow joint. So this is the elbow joint, this is the hand and the wrist segment. So the brachioradialis muscle. So the fulcrum is at the one end. The weight is the point of insertion of the brachioradialis is the effort. So the flexion of the elbow joint. So here fulcrum at the one end, weight at the middle, effort at the other end. The action of brachioradialis in the action of flexion of the elbow joint is an example of second order lever. And then comes to the third order lever. When you come to the third order lever, the fulcrum comes in the effort. The effort comes in between the fulcrum and the weight. So here you can see the weight sum, the distance between the fulcrum to the weight. The weight sum is more than the effort's arm. The weight arm is more than the effort sum. So what happens when the weight sum is more than the effort arm? There is mechanical disadvantage. So in order to, so if the weight sum is more, if the weight sum is weight by effort, weight 20 and effort is less, very less, and in order to lift the weight, we need more weight, more weight, more effort in order to lift, we need more for. So in order to lift 20 kilogram of weight, we need to put a 40 kilogram effort, because the effort arm is less, because the weight arm is more. So there is a mechanical disadvantage is happening here. An example of the third order lever. Example of third order lever is elbow flexion. So again, the humerus, the elbow joint, the forearm, the hand segment, the biceps muscle inserted into the bicipital tuberosity of the radius. So the fulcrum, effort and weight. So here you see the weight sum is more than the effort arm. The weight sum is more than the effort arm. So this is an example of the third order lever, biceps action during the flexion of elbow joint. So that's about the levers in physiotherapy. So why the knowledge of levers is important in physiotherapy? Because when we know about the knowledge of levers, it is very helpful in giving the resistance training to the patient. Okay. So for example, if you want to resist the shoulder abduction, instead of keeping the elbow in the straightened position and try to do abduction, we can give less effort is required when we ask the patient to do elbow flexion and try to do abduction. Less effort is only required in order to do abduction. But when we keep the elbow in the extended position and try to do abduction, more leverage is happening. Okay, more leverage is happening. So more effort is required when you keep the elbow in the extended position. in order to do the shoulder abduction. So the knowledge of levers is very, very important in implementing the exercise modalities for the patient in exercise therapy. And next comes the another important topic called the torque. Torque. What is torque? Torque is the force that causes rotation on a body lever. Torque is the force that causes rotation on a body lever. So what is torque? Equation for torque, T. Torque T is equal to force times the perpendicular distance. Force times the perpendicular distance. I'll give you the example. Example of elbow flexion by biceps muscle. So the biceps get inserted into the bicipital tuberosity of the radius, and this is the action of elbow flexion. So torque T is equal to force times the perpendicular distance. So this is the fulcrum. Force times the, so what is the perpendicular distance? This is the perpendicular distance, is the distance from the joint axis to the line of pull of the muscle. This is the perpendicular distance. Perpendicular distance is the distance from the joint axis to the line of pull of the muscle. Line of pull of the muscle is the point where the muscle is inserted to the bone. So if this distance, if the distance from the joint axis to the line of pull of the muscle can be rewritten as moment arm. If the distance from the joint axis to the line of pull of the muscle is renamed as moment arm, then the torque definition can be renamed as force times moment arm, MA. So torque is the force that causes rotation of a body lever. Torque T is equal to force into perpendicular distance. If the perpendicular distance is the distance from the joint axis to the line of pull of the muscle, is also known as moment arm, the torque formula can be rewritten as force times moment arm. Okay, so according to the position of the joint, the torque produced by the muscle also increases as well as decreases. If the muscle is inserted at 90 degrees to the bone, if the muscle is inserted at the 90 degrees to the bone, the moment arm is always larger. Okay, very, very important. If the muscle is inserted at 90 degrees, the moment arm, this distance, this perpendicular distance, the moment arm is larger when the muscle is inserted at 90 degrees to the bone. When the moment arm is larger, the torque produced by the muscle is also higher, and the efficiency of the pull of the muscle is also more. The muscle can produce contraction with maximum efficiency. That's the reason why when you are doing for an arm wrestling, you are keeping your forearm at the 90 degrees and try to do. So at 90 degrees, the momentum is more at 90 degrees than when the muscle is at acute angle or at obtuse angle. The power of pull of the muscle is larger when the muscle is inserted at 90 degrees to the bone. This is because the muscle is having the maximum moment arm at 90 degrees of the insertion of the muscle. Okay, so torque T is equal to force times perpendicular distance, and torque is the force that causes rotation of a bony lever. Hope you understand. So now coming back to the parallel force system. So parallel force system, in a parallel force system, the forces acting parallel to each other. It doesn't have a common action line. Example of a parallel force system is that the action of hamstring muscle in the flexion of knee joint. The action of hamstring muscle in the flexion of knee joint. As you know, the hamstring is not an individual muscle. It has got three muscles. It has got the biceps femoris, semitendinosus, and semimembranosus. In that biceps femoris is seen on the lateral side, and the vastus medialis and vastus lateralis on the medial side. So when the biceps pull, you can see it. There is a parallel force system exists. The biceps femoris is more towards the lateral side, and the media semitendinosus and semimembranosus more on the medial side. So when they pull together, it produces a parallel force system. Okay. Another example of a parallel force system, and when you think about the force couples in parallel force system, you have to think the action of the when you go for anterior and posterior pelvic tilt. So imagine when you are going for an anterior pelvic tilt. When you are going for an anterior pelvic tilt, when you go for an anterior pelvic tilt. So when you are going for an anterior pelvic tilt, which all muscles is have a what is the when you are going for an anterior pelvic tilt? What is the action happening? Hip flexors are working during the anterior pelvic tilt, as well as the lumbar extensors works as a force couple. Okay, works as a force couple. So they work parallel. So hip flexors are working anteriorly, and lumbar extensors are working in as a parallel force couple in order to produce anterior pelvic tilt. Got it? And imagine the reverse action in a posterior pelvic tilt. In a posterior pelvic tilt, which all muscles works as a force couple? Parallel force couple. When you're going for a posterior pelvic tilt, the abdominal muscles and the hip extensors works as a force couple in order to produce the posterior pelvic tilt. Imagine your abdominal muscles are weak. Imagine your abdominal muscles are weak. What happened? The posterior pelvic tilt will not happen. Instead, what happen is that the hip flexors will work more. The hip flexors will work more. Try to pull the hip, the pelvis anteriorly. Try to pull the pelvis anteriorly, and what will happen? So, what will happen? Instead of preventing the anterior motion of the pelvis, the hamstring muscle will try to pull the pelvis posteriorly. The hamstring muscle will try to pull the posteriorly, which result in the tightness of the hamstring muscle. Okay. So, in the case of anterior and posterior pelvic tilt, in case of anterior pelvic tilt, the action of the hip flexor muscles with the lumbar extensors works as a parallel force couple in order to produce the anterior pelvic tilt, and the posterior pelvic tilt, the action of the abdominal muscles and the hip extensor work as a parallel force couple in order to produce the posterior pelvic tilt. So that's about the parallel force system. And next one is the concurrent force system. A concurrent force system exists when two or more forces acting at a common point of application and forms an angle to each other. Okay, a concurrent force system exists when two or more forces acting at a common point of application but forms an angle to each other. What is an example for that one? Imagine a concurrent force system acts at a common point of application but at an angle to each other. Example can be the deltoid muscle. Deltoid muscle has got the anterior fibers, the posterior fibers, and the middle fibers. And they forms an angle with each other. And when these muscles contract, the total force produced by the muscle, FMS, will produce abduction of the shoulder. Can produce the abduction of the shoulder is an example of concurrent force system. Okay, is an example of concurrent force system. Hope you understand the basic of biomechanics, kinesiology, kinematics, and kinetics. So that's about the basic biomechanics. And next, another important topic when we are coming to the shoulder. So all these things what I explained was the basic things about the biomechanics and basic anatomy of the joints. And next topic we are going to cover the very important topic, the static and the dynamic stability of the shoulder joint, and we'll go to the various conditions that are affecting the shoulder joint. Hope you understand. Thank you so much.